Shane is done and put him on the hot seat, okay? All right. I'll let you take it away, Shane.
Okay. Important clicker.
Thank you.
Thank you.
Hi, Cohort 22. Good afternoon. I'm Shane, and I'm here to tell you about a revolutionary new product to assist people with poor bladder function. So let me introduce Mary. Mary is probably someone you know, your mother, your sister, could be your friend, or even yourself. Mary is active. Mary likes to walk her dog Spot, but Mary has a big problem, and that is Mary can't empty her bladder. Spot wants to, but it's making a big problem for Mary to take her out to do that. So Mary's underactive bladder disorder is keeping her from doing these things she enjoys in life. What does Mary face? Mary faces discomfort. Mary faces psychological distress, common infections, and often having to wear a leg bag like this with a typical Foley catheter. If she wants to go the route of an intermittent catheter without a bag, there's frequent self-catheterization, which can lead to a psychological stigma, and it's very inconvenient for the patient. Mary's not alone. About 2% of female Medicare beneficiaries suffer from an underactive bladder disorder. And it's a big market. Worldwide, products for treating bladder disorders like this total up to almost $4 billion right now and growing every year. And the segment of the market, about 95% of the market, is to address active patients with an underactive bladder disorder. Now, what healthcare providers are giving the patient right now, what they can get from home healthcare, from their local pharmacy, or in a treatment setting is not quite cutting it. It's still giving them that leg bag or that stigma. There's still the possibility of common infections. So Comfort Catheter is a different idea, and I apologize about redacting. We're still in our patent application right now. Comfort Catheter takes away the stigma and the need for self-catheterization. It's inserted once per month and remains with the patient for the rest of the month. Comfort Catheter requires no leg bag. It's normal toilet use. Comfort Catheter also helps mitigate the risk of urinary tract infections because Comfort Catheter remains in the bladder all the time and doesn't have to be inserted. It doesn't have a tube coming out. Comfort Catheter does not require any sophisticated devices, external devices that the patient has to carry with them to facilitate relieving themselves. Comfort Catheter is a simple mechanical device, easy to start, easy to stop. When you're done urinating, Comfort Catheter retracts back into the bladder and is clean and comfortable. So, Mary's quality of life is improved, and so is Spot's, because now Spot can do his business too. Where are we right now? Okay, in our timeline, we've gotten through the initial concept, CAD, prototype development. We're even gone through several cycles of refinement. And right now, we are at the point of filing for provisional patent protection. The next steps from here, we move on into benchtop in vitro testing, are finalizing our design, filing for a utility patent, and going through all the process to set up for the FDA 510K clearance, as well as obtaining IRB approvals. It's a complicated process, which will get us down one day to being able to market the product. Our team consists of a team of urologists from here at UC Health, Dr. Maddie and Dr. Camel, going from the left to the right, and an engineering team from UC, consisting of myself and Dr. Nemnen. Now, we've addressed the engineering and the physician side, the medicine, but what we still need is that regulatory expert and a market expert to help us get this product out there and over those hurdles. In summary, we need to solve Mary's problem, and to do that, to get Comfort Catheter done, we need to perfect the Comfort Catheter, we need to obtain patent protection, and we need to navigate the FDA regulatory landscape. So this is where we stand, and this is where we ask for help. Which brings me to the end. Maybe a little quick, I don't know, but do you have any questions? Yes, sir, you had a question. Yeah, don't do that in a you know, it's like a bid right there, holding the thumb up. You just spent $1 million.
Does anybody have questions for Shane? Comments? Yeah.
I apologize about being short on the technical aspects of how it works. Yes?
How long do you expect that the approval to take?
Well, that's where we need the help. We need an expert to help us navigate that regulatory environment. And we know that's a long and drawn out process unless we can obtain some lower classification of a device. I'm pretty certain it's going to be a class 2 device, but maybe if it's classified as a class 1 device, we might get away with an exemption as being significantly similar to other devices. There are other devices that remain in the bladder right now, but have an external drain tube and have an external activation device and are electronic. Our device is simple, purely mechanical.
RJ?
Yes.
Yeah. How do you envision the device being, I'll say, implemented? So is it an at-home insertion, or is it a trip to the doctor, to the hospital, or whatever it might be?
A trip to the doctor once a month, most probably for insertion and removal, but remains with the patient the rest of the time.
How long can they stay in the body?
So our target is the full 30 days that would be allowed under ISO 10993 material conformance.
All right. Thank you very much.